Hi everyone, my name is Hallie Johnson and I am the Patient and Public Involvement Coordinator at the Cicely Saunders Institute. I hope you've been enjoying the summer school so far. You will have hopefully already heard from my colleague Jonathan, who had talked a bit about what palliative care is. I also thought it would be useful for you to hear about palliative care from the perspective of a family member who has lost a loved one. For the next 10 minutes, you are going to hear an audio recording from Marion, who was a carer for her mother. She's going to tell you a bit more about her experience of palliative care and why it is important. I'd encourage you to send Marion and I any questions you may have after listening to the following email address listed on the PowerPoint. Thank you.
Hello, my name is Marion. I'm talking to you today about palliative care from the experience of patient and family members. Talking about death and dying isn't easy for anyone. It's hard and it's challenging because it involves loss and deep emotions, and we don't want to lose the people we care about. But it is part of being human, and I believe it is important not just to talk about it, but accept it. This is what palliative care does. It works specifically with people at end of life and supports both the patient and their close family members. It involves a whole range of clinical and healthcare specialists who are different parts of a team that will support the patient. There's no one way of delivering palliative care. It can last for a few days, a few weeks or months, and at most in the last year of a person's life. It is completely dependent on the patient in question. Its main priority is to help a person live as well and as comfortably as they can until they die. This includes pain and symptom control, personal care, rehabilitation, as well as providing practical and emotional support to both the patient and their family members. The core belief underlying palliative care is to treat a person holistically, mind, body, and spirit, and that a person's life matters right up to their death. People are not just bodies that need treatment, but their whole selves. How someone thinks or the beliefs they hold can influence the way they respond to the treatment. So a patient's needs and choices are respected when being treated by a palliative care team. Their lives, their family, and even their pets are part of their life and recognized as being important to them at end of life. Or not, it is up to the person, and their choices are integrated into treatment during palliative care. Many people want to be able to die at home, and there is a greater help with this now. Teams of community and specialist palliative care nurses visit people in their homes to ensure that they're comfortable, check their medication, and support them and act as a point of contact to manage any changes. In hospitals, there are teams of specialist palliative care doctors and nurses overseen by a consultant. These teams support patients and their families and manage treatment at end of life. For a longer term of treatment, rehabilitation will be given to support the patient's physical needs, helping them with physiotherapy and other support therapies. Bereavement teams work with patients' families afterwards and ensure they're respected and supported. Many palliative care teams in hospitals are trying to find better ways to support patients. One team has created a symbol, a purple butterfly, which is used to identify that the patient is at end of life. So that informs everyone else working in the hospital, from the porters to the people delivering the meals, the people who run the shops, anyone and everyone. And they all understand that that patient is being supported as they face end of life. This ensures professional respect is given to them and their families at all times. Care homes, sadly in the news now more than ever before, also provide palliative care to their residents, working with GPs and community health providers to ensure the appropriate medical support is provided. Normally, they involve any family member and do their best to provide the respectful support someone needs at end of life. And there are hospices. who not only provide inpatient beds for end of life, but also treat day patients. They come in for rehabilitation, such as physiotherapy and occupational therapy, as well as providing complementary therapies. They're also able to engage in creative workshops, art, writing, singing, helping people share with others, if they choose to. There is an understanding that patients are not just living with their diagnosis, but being able to come to terms with it and to express their feelings through this work, which helps them to value themselves and their lives. It also provides a space where patients and families mix with volunteers, nurses, and every member of staff, and can just be in this safe space. Family members are also supported to deal with the loss of their loved ones. Many people still fear going into a hospice because it is associated with the end of life and with death. I can only tell you that in my experience as a carer for my mother, that it is a place where everyone is respected. You walk through the door and no one is judged. If you're there for the same reason as everyone else, and you have no need to explain. Everyone is respected. It is a safe place. You can visit at any time if you feel the need to go there and just be there to sit with your own thoughts. The artwork on the walls reflects people's creativity, and their work lives on for others to share. The hospice is one of the most life-affirming places I have ever been in, and when we move through this current period, you would be welcome to visit one and experience it for yourself. So, why is palliative care so important? Because in the words of Dame Cicely Saunders, how someone dies lives on in the memory of others. I'm going to repeat that. How someone dies lives on in the memory of others. I cared and supported for my mother when she became ill and saw how she was treated. I managed her medication, visits to hospitals for treatments, checkups, organised the visits of GPs and district nurses, made sure she was comfortable, dealing with emergencies. It was a difficult time. But I will never forget when she was transferred to the hospice. The palliative team took over. They asked her what she wanted and agreed with her how best to proceed. And then they made her as comfortable as they could. She was the patient, and they respected her choices. I owe so much gratitude to all the staff there for the support and kindness, including humour, that they gave to her and everyone else there. So I, like many others, know from first-hand experience how fundamentally important palliative care is. They allowed me to become just her daughter again, and we had those weeks together. The memory of that lives on. I will end with the acknowledgement that we are all living in extremely challenging times. Now, more than ever before, the need for palliative care is underlined. For how many people will be living with painful memories of how a loved one died, and I am aware that bereavement teams are looking to find the best way to reach out to grieving relatives and friends and deliver meaningful support that will convey to them that their grief will not pass unnoticed. I understand that you're involved in the summer school to consider training in medicine and learning about the different areas of speciality. So, as you consider your choices and try to decide what your first step might be, I will leave you with the last 3 lines of a poem that looks at, in essence, what it is to be alive. It raises a question that only we can answer for ourselves. The poem is called The Summer's Day by Mary Oliver. It is basically about a person sitting in a field on a summer's day and accepting it is enough just to be alive and wonder at all that we have in life and to see nature and appreciate it. And the lines are, doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? I wish you luck with whatever you do in your life, and remember that sometimes you need to take one step and see where that leads you. Take care. Bye.